Hello and welcome to Seven Sentinels. This is Grandmaster class and I am Peter Simon with you. Today we are conducting speaking sessions and here we have Mahesh Kalal with us. He is from Jamnagar, Gujarat, India. He is a nurse by profession and now we are going to do the warm-up session. Yes, Mahesh, you can open your video and you can open your audio also. Yeah. So you can turn your mobile.
Now it is
Auto rotate. Yes, that's it. We are set.
yes, sir.
Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. We are providing quality training for the medical professionals. And these are part of the sessions and we are doing the speaking sessions and this is a warm-up session for a nurse. The name is Mahesh Kalal and is from Jamnagar, Gujarat, India. These are the daily dosage profession-specific speaking materials and nursing profession-specific speaking tasks. Mahesh Kalal, can you please tell me something about yourself?
Yes, sir. Good evening. Let me take this opportunity to introduce myself to you, sir, because it gives me immense pleasure. By the way, my name is Mahesh Kalal and I am 30 years old. I am a bibliophile, music and chess buff, and I am an Indian and hail from Udaipur city, which is located, which is also known as Lake City. This city is located in the northern part of India. My mother tongue is Hindi, and but I can also speak Gujarati and English. I love my country so much because I am patriotic by nature.
Why did you choose nursing as your profession?
That's nice question, sir. I would be glad to answer these questions. There are several reasons behind choosing nursing as my profession. First of all, I wanted to serve in medical field uh, because it, because it is a noble field in which we have to provide care to humankind to restore their life from any kind of illness. Apart from this. Uh, Apart from this, I have seen many person who work in this field and has name and fame. Uh, furthermore, uh, Furthermore, availability of many scopes in both in native place and abroad, anesthetic nurse, psychiatric nurse, pediatric nurse, and theater nurse, and so on. Therefore, I opted nursing field as my profession.
What is your fundamental reason for taking the occupational English test?
So working overseas has been my dream since when I have passed my OET degree, and therefore OET is a fundamental benchmarks which requires to pass for working in the United Kingdom and Australia as a registered nurse. Additionally, we are dealing with real life scenario in OET exam, and these are the reason for me to take OET exam.
Which country is your most favorite destination for migration and work?
Sir, my favorite destination to work and migration as a registered nurse is the United Kingdom, since the UK has the world-class health system and health facilities. While working, I would leave no stone unturned to explore my profession. And one more reason for migration to the UK is good remuneration and respect for nurses as compared to other countries.
Comment on the special qualities of the contemporary or the present generation nurses?
In my view, sir, being a contemporary nurse, one should have a good communication skill because because our because our profession requires good communication skill to deal with different type of patients and relatives, like someone who is in pain and other who is so aggressive. And apart from this, today's nurse should be skillful and up to date as advancement in technology in medical field, sir.
What is the regular routine of an ideal nurse?
So well, it depends on person or depends on nurse which in which she is appointed, sir. Generally, in ward and ICU, we start our day with taking handovers from the previous duty staff, and then start taking inventories. Then we take rounds with doctors for the patients, and then we go with the routine work like checking vital signs of the patient and giving medication as prescribed by the doctor. And at the end, we give handover to the next duty staff and relieve from our duty.
One last question regarding the role models. As far as your profession is concerned, who is your role model?
Sir, it would be pleasurable for me to tell about my role model. My role model is Papia Chatterjee. She is currently posted in one of the renowned hospital in Ahmedabad. She is so kind-hearted and she has so many good attributes as a leader as a nursing leaders. And I want to follow her path to source height in my career.
That's really a very nice warm-up session. Thank you very
Thank
much.
you, sir. Thank you, sir.
And now, here we are. I'm going to give you some feedback regarding the present session. Mahesh, Kalal, you have done a good job. You have good confidence. The level of confidence is very excellent. And then what you are supposed to do is you have to focus on certain areas. So that's what I'm going to tell you now. First and foremost, you said many person. Many person. Many is plural. So persons, not person. So be careful of that. Then next one, you said both native place and abroad, something like that. Both the native place, because it's only one. The native place, you have to use the definite article the. And next, the third one, which I noticed is you said depends on. Then after you got stuck, and again you said depends on. So you're repeating. The next one, there are some pauses and breaks here and there. Maybe your thinking process is hindering the pace. So you will have to practice speaking in English. You're not a regular speaker of English. You're speaking in your mother tongue or any other vernacular language, maybe, or you may be speaking in some other national language, but you're not using English to the extent that you have to use. So that is one drawback. So what you have to do is you have to practice on a regular basis. You can take the speaking. How do you do this? Is you can take a reading session or a newspaper or something and just press the audio button. Okay, voice message, and then you can read out the paragraph and then send it to me. So every day, morning 20 minutes, afternoon 20 minutes, evening 20 minutes. If you read like that, you will give exercise to your lips,
Yes,
mouth,
sir.
tongue, vocal cords, throat, and your lungs. And then you'll get the habit of, practicing regularly, because practice is impossible for many situations, many reasons, in many situations, because, majority of the people, we feel what will others think, maybe I am wrong, hesitation, and others are not interested, and they discourage you. Like this, there are many occasions what happens, what hinders your practice. So what you can do is you can do this process. The next one, pronunciation. How you can develop pronunciation? You can watch some in English channels like BBC or CNN or adventure channels, something like that. And then you have to play the video, television, and then you don't look at it. Just close your eyes and focus on what they are speaking, how they are speaking, the manner, the pronunciation, the accent, the style. Yeah, so follow that one and catch one particular word which you catch properly. Repeat it immediately. Once the word is told, immediately after that one, you then one sentence gone, then another sentence, another word you catch. So every time one word you catch in each sentence and repeat as the other person, native speaker, is speaking. So that's the way how you can improve. First day you catch only one word. Second day try to catch two words together and then speak. Third day you catch three words. Fourth day 4 words, like that. So increase. So maximum you can catch up to 5 to 6 words. Then you see how you are doing that one. Right. The next, the length is fine, fluency is okay, confidence level is excellent. Accuracy, yeah, we have some problem with accuracy. So how you are going to do that is what's it? 3 types of accuracy. Once again, first one is grammatical accuracy. Grammar, is the grammar appropriate? Is the grammar right? Am I speaking correctly? Is the message passed down to the other person? And is he able to understand? That's the called grammatical accuracy. Then second one is the vocabulary accuracy. Accuracy concerning vocabulary. Am I speaking the right word? Am I using the proper vocabulary? That's very, very important. For example, you said since when I, something like that. Since when I. Since means starting point of time. When you use since, you have to use starting point of time. Since my childhood. Since 1996, since December, means from December onwards. Okay, that is what is since. From that time till that this time, that is called since. Otherwise, you can say period of time for the last. So this is part of grammar also and vocabulary also. And vocabulary, for example, some people say myself, Simon Peter. It's wrong. You cannot say myself, Simon Peter. It's I am Simon Peter. Okay, I am Simon Peter, or my name is Simon Peter. Myself, Simon Peter. Myself, what do you mean by myself? Myself is a reflexive and you cannot use it. So many people do this mistake. Myself, Simon. No, it's wrong. I am Simon. Myself is a reflexive, how it is used. So I hurt myself. I blamed myself. I punished myself. From me to me. So that is reflexive. Nobody is involved here. I to me. I hurt myself. Nobody hurted me. I hurt myself. So like that one. So the words what you are using, you have to be little cautious. Then third one is the pronunciation. Pronunciation, I told you how to improve your pronunciation. That's really fine. Then next one. Other than that, I think everything is fine. Now the autopilot, Simon's autopilot is already there. It is recording your voice, and then it is going to transform your whatever you have spoken in the dialogue form, like interlocutor grandmaster. So that's me, and your nurse Mahesh Kalal. So with your names, everything will come there. So I'm going to give a PDF of what you have spoken, and afterwards, so this is the first phase, the interview. Preparation is done, then the practice is done. Then afterwards, we'll take that vocabulary, and then we will try to rectify our mistakes. I'll show you what 3 things. Number 1, what mistakes you are doing. That is number 1. I'll go to next lecture will be feedback for this speaking session. That will be a separate session. This is feedback, general feedback I'm giving you. But sentence by sentence, word by word, line by line, everything I'll correct. You're speaking also, because nobody gives like that one. And I want to transform the style, and I'm going to give you that one. So I will give you first identifying mistakes. Number 1. Number 2 is correction of the mistakes. Number 2, and improvement of the quality. This is number 3. So 3-dimensional feedback I'll give you later. This is just a general feedback of your performance, what mistakes you overall. So just a gist of the summary, gist of the feedback I'm giving you now. But the main feedback is going to follow. Is that clear?
Yes, sir. Clear, sir.
Open your video, and then now what I want you to do is you have to give your feedback regarding the session. Many people hesitate to come in front on the video. When you came on the video here and you feel that you're a little confident, your confidence level goes up, and you say, you think I can also do this. Many people. So earlier you were a little hesitant whether I can do it or not. But now once you stepped onto the stage and you started participation and everything is in place and you are you're performing excellently well. So now can you give me your feedback regarding the present session?
Sir, you are teaching us so very well, sir. Due to your teaching methods, my rusty English has been improving, and it is getting brighter, sir. Uh, and also, sir, whatever you are teaching, like especially in writing and speaking session, you are means you are finding each and every mistake where we are committing mistake, like grammar, means articles, and spelling. These all are mistake you are making us found. So next time whenever we're writing and whenever we speak up, at the time we keep in mind that where we are committing mistakes, so next time we keep in mind to avoid such mistake.
Yeah, and before joining, you had a complaint regarding the learning styles others are teaching. You said you prepared, you studied, and you spent thousands and thousands of rupees trusting them, and you paid them, and afterwards you did not get the required, requirements were not fulfilled, and you were upset. And when you were joining, you said, "Sir, is that what I'm going? I trust you, but I." So now I want to ask you: have you got what you expected? Did you get 100% or just 50%, or you did not get anything at all? So your suggestions are very important so that we can rectify and improve the quality what we are providing to our students.
Yes, sir. No doubt, sir. I did get whatever I want, sir. You are giving us more than 100%, sir. But it has been only 1 month having joined you. But I assure you, sir, within 2-3 months, I will be able to clear OET exam if you teach us like keep teaching us like this, sir.
So what is the message for the other students who are attending our sessions? Because there are many students who are not participating regularly. So what is your message for them? And
I
there are
should
many
say,
other people who are watching also. For them also, I want you to give some suggestions how about our classes, how we are conducting, and just you can give how you're there, how I'm able to meet your requirements at different timings and all these things. You can just tell.
yes, all students can join you, sir, for a better class and better teaching. And if they really want to have improvement in not only this OET exam, but overall grammatical accuracy and anything related to English, they can join you, sir. Because you are not ordinary teacher like who has only had a OET pass and on nursing. As a nursing you are teaching us, but you are like uh, as a what I can say, sir, you have already graduation in I think English exam, English from I think other countries. So it would be definitely helpful for other to join you if they want to join you, not like other joining others like uh,
Right, and that's very nice. You have given your feedback. Thank you for your valuable suggestions. We'll implement them for the betterment of all the students, and your suggestions mean a lot to us. Thank you once again. And the viewers who are watching this program, if anybody is interested in the sessions, you can just contact me personally. The number is 9877867360. That's all for today. Thank you. Have a nice day.